Let me ask you something, and I want you to be completely honest with yourself. If a heart attack were starting inside your chest at this very second, would you actually know? Most people say yes. They imagine the Hollywood heart attack, clutching the chest, sudden collapse, chaos. But here's the reality doctors see every day. For most people, a heart attack does not begin with a scream. It begins with a whisper. It starts quietly, silently. A microscopic chain of events deep inside your blood vessels, months or even years before anything dramatic happens. And that silence is exactly what makes it dangerous, but also what makes it preventable. Today, I'm going to walk you through what's actually happening inside your body. Not to scare you, but to give you clarity. The kind of biological map a doctor would give their own family. Why this matters more than you think. By the time a heart attack becomes dramatic, the process has already been unfolding for years. Your body is incredibly resilient. It compensates, adjusts, protects you. Because of that, the signals it sends are subtle, easy to ignore, easy to dismiss as stress or aging. But when you learn to recognize those early signals, you stop reacting to a crisis and start preventing it. The biggest myth about heart attacks. A heart attack is not your heart suddenly failing. In medicine, we see it as a supply problem, not a mechanical one. Your heart is an endurance machine. It beats over 100,000 times a day. It never rests. And because of that, it constantly needs oxygen. A heart attack begins when blood flow, that oxygen supply, gets restricted. Not suddenly, but gradually, like a slow sunset. That's why people feel fine until they don't. What is actually happening inside your body? Your heart is fed by coronary arteries, your lifelines. Over time, stress, poor nutrition, and inactivity damage their inner lining. Tiny microscopic injuries form. Your body tries to repair them, sending cholesterol and inflammatory cells. This creates plaque. At first, the artery is still wide open. You feel normal. Then it narrows. You feel slightly more tired. But ignore it. Inside, your heart is working harder. Emotionally, you feel drained. Practically, you start doing less, taking elevators, avoiding effort. Then comes the tipping point. That plaque can rupture, like a blister. Your body responds instantly, forming a clot. Within seconds, blood flow can drop to zero. That's when the pain hits. The heart muscle is suddenly starved of oxygen. The countdown. 5 silent drivers. To prevent that moment, we need to understand what builds the problem. Mistake number 5. Chronic inflammation. This is the hidden rust of the body. Biologically, it makes artery walls sticky, so plaque forms easily. Emotionally, it feels like fatigue or brain fog. Practically, blood pressure begins to rise. Mistake number 4. Ignoring early fatigue. Your heart whispers before it screams. Biologically, your cardiac reserve shrinks. The heart works harder just to keep up. Practically, people respond by doing less, which weakens the system further. Before we go further, if this is resonating with you, stay with me. The next points are the most critical. Mistake number 3. Poor sleep and constant stress. Sleep is when your heart recovers. Biologically, heart rate and blood pressure drop during deep sleep. Without it, your body stays in fight or flight. Emotionally, you become irritable. Practically, high stress hormones increase fat storage and strain your system. If this is hitting home, hit the like button and subscribe. This isn't just information. It could help save a life. Mistake number 2. A diet that stiffens arteries. This isn't about perfection. It's about long-term impact. Biologically, excess sugar and processed fats damage artery walls. Think of it like tiny scratches building over time. Practically, your energy crashes, and your heart works harder to push blood through stiff vessels. Mistake number 1. Assuming no pain means no problem. This is the most dangerous mistake. Your body can compensate for a long time. By the time chest pain appears, an artery may already be 70% blocked. Emotionally, we ignore warning signs. Practically, we skip checkups because we feel fine. But feeling fine is not the same as being healthy. What actually helps? Now let's simplify what you can do. First, move your body. Even a 20-minute brisk walk helps your arteries relax and stay flexible. Second, reduce inflammation. Focus on whole foods and proper sleep. Third, listen to early signals. Unusual fatigue, tightness, or sweating, get checked early. Fourth, know your numbers. Blood pressure, cholesterol, blood sugar. These are your warning lights. Don't ignore them. I want to leave you with this. Your body is not your enemy. It has been protecting you your entire life. A heart attack doesn't start with drama. It starts with small, silent changes. And that's the best news you'll hear. Because small changes can stop it. Your future is shaped by your daily habits. You can improve your circulation, reduce your risk, support your heart. If this helped you understand your body better, subscribe and share it with someone you care about. Because knowledge saves lives, but action preserves them. Remember, small changes build strength. Understanding builds freedom. Take care of your heart and I'll see you in the next video.